Hello and welcome to Frontline. Now, what a time we've had to deal with the last 1 year. The pandemic struck and our lives have changed in ways we never imagined. Kenya Red Cross Society has been on the front line battling this virus since the first case was reported here in Kenya in March of last year. The society has also been affected by the virus. To help us paint the perfect picture of how this war has been for the country is the Secretary General of Kenya Red Cross Society, Dr. Asha Mohammed. You can join the conversation using the hashtag Frontline on our social media handles, that is at Switch TV Kenya, at Fred Mwitidiri. You can also send in your feedback on our SMS line, that is on 111 444 111. I repeat again, that is on 111 444 111. Well, my name is Frederick Mwitidiri. Now, have you ever wondered where Red Cross organization came from? The importance of Red Cross and its uniqueness. Namukana Samuel has quite an explainer on this organization that was formed more than 150 years ago. Take a look.
I took my time to get through the streets of Nairobi to understand what the Kenyans knew about the Red Cross organization.
Kenya Red Cross wanga inasaidia watu like kusaidia watu wenye wanga jiezi, like kupeana manguo, foods.
Nimeshaisikia kuhusu Red Cross na wanasaidia watu ambao wako kwa shida and all that. So far so good, they're helping out.
The puzzle on their faces continue to be unsolved.
Mambo ya Red Cross sijasikia bado.
About Red Cross, nasikianga tu wanakujanga maybe mahali disaster imetokelezea, wanakuja wanasaidia.
Red Cross idea was born in 1859 when Henry Dunant, a young Swiss man, came upon the scene of a bloody battle in Solferino, Italy, between the armies of Imperial Austria and the Franco-Sardinian alliance. Some 40,000 men lay dead on the battlefield, and the wounded were lacking medical attention. Dunant organized local people to bind the soldiers' wounds and to feed and comfort them. On his return, he called for the creation of national relief societies to assist those wounded in war and pointed the way to the future Geneva Conventions. For the past 15 decades, the Red Cross Society of Kenya has been offering help not only to those who are wounded in the field but to anyone who may seek their help. The importance of Red Cross is to bring assistance without discrimination to the wounded on the battlefield endeavors to prevent and alleviate human suffering wherever it may be found. Its purpose is to protect life and health and to ensure respect for the human being. All Red Cross programs and activities are guided by the fundamental principles of humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. Namukana Samuel, Switch TV.
Now, right about time, joining us in studio is Dr. Asha Mohammed. Thank you so very much for joining us. I see you've been doing a lot of work on ground. How has this pandemic impacted the society?
Thank you very much for having me. I think to start off, I can say that as an organization, it called on us to, first of all, even change the way we were working. Because this is one time when the disaster happens, but it also affects the responders in terms of saying that, yes, our staff and volunteers were themselves members of this same community and could be at risk of getting infected. It affected our programs because it meant that some of our long-term programs had to be delayed because now we had this big emergency to deal with. So we had to sort of put aside some of that other work as we try to readjust how to go about it.
Some of these programs that have been affected, some of them are like which one? So that if there are Kenyans who are wondering, what happened? We used to receive this help, it's no longer coming. Some of them are like, which one?
We have some of our long-term programs which are dealing with other health issues. For example, you have immunization programs, you have maternal and child health programs, you have programs that are looking at non-communicable diseases like the cancers and others. So those had to slow down because now the same resources, the same human resource had to be deployed to actually deal with the COVID-19 pandemic.
I'm looking at what is happening in India right now. I am sure you are aware of what is happening in India. Are you afraid as a society that if the virus is in the country, we might be overwhelmed?
I would say yes, very afraid, and we continue to reflect and to prepare and also to do what we can to just mitigate this. For example, we are looking at the question of how our communities are also structured. Today, we have people who are still living in camps because they were displaced by floods in 2019. Imagine something happens in that camp where people cannot even keep the social distance. It's a big problem. So some of the things we are doing also is, for example, ensuring that people have good shelter where they can be able actually to even try to space within the family, but also the other measures of hand washing facilities and all this kind of issues. So working again closely with county governments, trying to also see how we can support in terms of PPEs and all these other measures that need to be taken into place. Yeah.
You must be having so many other challenges, like you're mentioning some of them. So what are the major challenges right now Kenya Red Cross is facing in regards to COVID-19?
Well, one of the major challenges is really, like I said, the multiple other disasters that are happening at the moment. As we speak, we have flooding in some counties, we have drought in some counties, and still we have to also combat the COVID-19 pandemic. So dealing with these multiple disasters at the same time in an environment where the risks are also very high is really one of our biggest challenges, because we have to see how to protect our staff and volunteers, but also how to protect the communities that we serve. Secondly is the issue of resources, because somehow it seems like there's also a bit of a fatigue, I would say, from the partners and donors in terms of even the pandemic itself. Now everyone is moving on to vaccination, and we are saying it's not a magic bullet as well. It's important and it will make a big difference, but it cannot replace the other IPC measures that need to be put in place. But not much support is coming for those kind of issues. Everybody's just looking at vaccination. We have these other emergencies that I mentioned. They are also not getting the same kind of support that they would normally get. So you're having people in a very, very vulnerable situation. As we've just seen, people are just even trying to find food to put on the table. So how do you then tell them that they need to stay away and not go out and look for work? Because if they don't do that, then they will not have food.
Now, as the virus spread rapidly across the continent, governments imposed strict measures to slow down the spread of the disease. However, these stringent measures have gravely affected the livelihoods of informal settlements. Our reporter Harriet Chimea files the report on Kenya Red Cross efforts to cushion residents through a cash transfer program.
Sasa mimi wanafanya kazi hizi za hoteli hizi ndogo ndogo, lakini nilishukuru sana watu wa Red Cross, walinisaidia kabisa kabisa. Mimi kama msasi nilikaa chini nikafikiria, nikaanza kuchukua samaki kidogo kidogo ndio nauza.
Hiyo pesa imenisaidia kujenga, na nikaanza kuku. Sasa hii nauza mayai. Naweza kuuza mayai, na Christmas niliuza kama kuku 5. Kwanza wakati zilikamu ziliokolea mbaya.
Mimi nilipata hiyo pesa, nilifurahia sana kwa sababu ilinisaidia. Mimi nilifaitika kwa hiyo pesa kwa sababu nililipa hii nyumba. Nilikuwa nimendaiwa miezi 4. Kibakisha tu kitu kidogo na nunua chakula.
These are just but the few beneficiaries from Kibra and Mukurunyayo who have benefited from the cash transfer program, and as a result, they have turned their lives around. Before COVID-19 hit, volunteers visited up to 8 households at most in efforts to conduct various programs, including cash transfer and surveillance across 10 informal settlements in Nairobi County. However, since the onset of the virus, Kenya Red Cross, through volunteers, had been reaching out to people through phone calls, a change that Jeff Otieno, the disaster management specialist, says posed a challenge.
One of the challenges was the community itself. So you're here trying to register someone and they have slept hungry for 2 days. So, pardon me, they've slept hungry for 2 days, so they are looking at you and wondering whether you can give them some money to buy some flour, or you can have questions with them to register them, and they really don't know how long this is going to take before they can get supported. because remember, there have been so many partners and organizations who've gone there to do this kind of program. So you see, this is difficult for them. Another challenge would be because we were faced with COVID, you'd be on the ground because we had to walk into houses. You'd be on the ground and come across very dire issues, people who actually need medical attention as of that time. So we also had to readjust and do referrals. The program provided cash. The cash was to be sent via M-Pesa to the community beneficiaries. So it was 7,668 for beneficiaries who are not benefiting from any other program. For those who are benefiting from Inua Jamii program, we were topping up, they were already getting 2,000. So we were topping up 5,668 so that it tallies with these other new beneficiaries.
So far, Kenya Red Cross has reached out to a record 17,000 people in Nairobi County only, and those in this criteria include childhood-headed households, women-led households, those living with disability, widows, and those living with chronic diseases.
When you go to the field, this is one of the major challenges. Somebody is telling you, or you're telling me to wear a mask. Well and good, but I don't have food. So how do you do? What do you do as Kenya Red Cross when you are telling them now there is a virus that is coming from India and you've got to prepare and you've got to protect yourself, and they tell you, I'm looking at food. What do you do as Kenya Red Cross?
So one of the things we've been doing, especially in the informal settlements and in some of the poorer communities in the rural areas, apart from the cash transfer, which we've just seen, we have also been doing direct food distribution. And we got a lot of support. I really want to thank a lot of the partners who came through, because that has really gone, a long way to really help. Because you can also do cash transfer, but if there is also not a good market in this particular area, it won't help. So there were some people that had to get food in kind, and then there were those where markets were available that actually got cash transfer. So when we find those kind of situations, we try to deal with that immediate problem in as much as we can.
I'm sure, just like all other sectors, even in the media, the society has been touched by the COVID-19. As a society, how has it been for you? You've been fighting on the front line, but inside, I know you've been affected in one way or the other. How has it been for you?
Yeah, it hasn't been easy, like I said, because we need to go out and support communities, but at the same time, we needed to make sure that we are also not exposing ourselves. But as members of the community, as members of this same country and population, we have been affected. We have had staff and volunteers and members who have tested positive. We've had others that have had to be in quarantine for long periods because they were in contact with some of these people. Unfortunately, we have lost a member of our national board as well to COVID. So we have been affected.
Your final thoughts on what has been happening in the country and moving forward?
Well, I think we've done well so far, but I think, like we said earlier on, is we just have to keep on and work with the worst case scenario.
All right.
I think that is, for me, the critical issue. It's okay if nothing happens and we don't get there, but it will be a disaster if we are not found well prepared.
Thank you so much, Dr. Asha, Kenya Red Cross Society Secretary General, with us here on Frontline. We'll be back with more in a short while. Now, when we discuss about issues concerning COVID-19, youth have somewhat been sidelined in the fight against the virus, yet they make up more than 70% of the country's population. Today in studio, we have Alex Ayub, the National Youth Coordinator at the Kenya Red Cross Society, as we discuss how young people have been affected by the COVID-19. Remember, you can continue this conversation using the hashtag Frontline on our social media handles at Switch TV Kenya and at Fred Muitiriri. You can also send in your feedback on our SMS line, that is on 111 444 111. Karibu sana, Ayub. Thank you so much. Now, tell us, what kind of support have you been able to provide for our youth as a coordinator in service to humanity during this COVID-19?
Yeah, thank you so much, Fred. I think one of the things that we actually, all of us were faced with was the fact that COVID-19 situation was very new to many people. And then it came to a point where a lot of things were disrupted. We had young people who were in a situation whereby their social spaces were disrupted, educational spaces had been disrupted, and many of them were locked out. So as Kenya Red Cross, having been an organization that works with communities and are present with the communities, we realized then there was a chance to be able to reach out to young people. And one of the major effects that happened was just basically an effect on their psychosocial well-being, especially on mental health. And this is for the various age groups, especially the school-going children. And then back at home, they were then faced with new realities that nobody had really anticipated before. And here we are talking about domestic violence sometimes were happening. We're talking about lack of food for many families and homes. We're also talking about very grave scenarios, especially in the informal settlements within Nairobi and also within the country, where even young girls were no longer in the space to be able to access some of the basic needs that they need, like sanitary towels and everything. So as Kenya Red Cross, we came in and looked at our programs, because one of our work is to basically alleviate human suffering and save lives. And as young people, we came together to not only be able to provide access to mental health services, we were also able to work with our communities to distribute sanitary towels to young girls, and also work with the various leaders and the community leaders and various units of the organization to provide food items and also non-food items to many communities that were worstly affected, where young people were actually not only beneficiaries of this service that we offered, but also they were active recipients, meaning they assisted us in even delivering the services itself to the community. Yes.
Now, you've talked about the disruption that has happened due to COVID-19. How grave is the situation on ground?
Well, I think it's one thing to say about it, to speak about it from a perspective of here at the organization at a national level. But then when we look at our branches at the counties and the work they've been doing and the communities, the situation is not really good. We are having young people who first, when you're talking about, I think the biggest problem was the economic impact, and especially on livelihoods that it had to many people. A lot of jobs were disrupted, and a lot of source of income for young people were disrupted. And it's actually, if you look at the industries that many people, we have seen a lot of people talking about them that were actually disrupted. These are industries that the key players on a day-to-day basis who work on a day-to-day basis are basically young people. So that means it was a ripple effect. There are people who are working in there, and then there are people who are depending on them. So economically, that was a big impact. And then this led to another problem, which was basically many people went into depression, mental health issues came up. In very adverse and extreme cases, we even had suicide cases. Young people, many people committed suicide during this period, and this is evidence with our call center at the 1199 Kenya Red Cross call center, where a lot of distress calls have been coming in. Well, this was far transferred to a lot of issues, and we are talking about domestic violence, gender-based violence, and happening in our communities, and and then of course, anytime an economic situation has been disrupted within a community, then if there are people who are getting their income, then automatically many of them would either go to drugs and substance abuse, especially young people, but also in matters related to crime. And these are actually things that are within our communities out there today. Yeah.
Now, as a department, as the coordinator, you see, young people, if they are left idle, and you are talking about all the disruption that you're talking about, if they are left idle, so much is going to happen. So as a department, what are you guys doing to ensure that they are engaged in activities and to manage the mental health crisis that we are seeing in the country?
Yeah, thank you so much, Fred. So if you look at the conversation on young people, there are various age groups within this. So we are talking about children, which is basically below the age of 12. And then we have adolescents who are between 13 and maybe 17. And then we have the young adults who probably go all the way to from 18 to 30 and so on. So we basically designed programs that will enable them, one, create awareness on what is happening in our communities, just the fact that we are aware of this is happening. We have mental health issues in their communities. But then number two, we also created programs that will capacity build young people, give them new skills, life skills, on various topical and thematic areas. You're talking about sexual reproductive health and rights, gender-based violence. You're talking about mental health itself, but also new emerging issues online child protection. These are things that we designed programs to be able to reach these particular age groups. For the older, what we call the young adults between 18 to 30 years of age, what we did was to create spaces for young people to come and give their services to the community and help in the work that we were doing, because then even our work doubled. There were a lot of other emergencies that were happening in the communities. COVID-19 was there, but we still had floods we were responding to as Kenya Red Cross. There were still areas where we even had droughts that they were still responding to even today as a country. So we created within our branches, the 47 branches, a platform where young people can come, subscribe and say, look, I am free. My school has been disrupted, but I want to give my time to the Red Cross and achieve what we're doing. Yeah, to volunteer basically with the Kenya Red Cross.
Hold that thought. Now, just before we go on with Alex, with the new strain of COVID-19 detected in the country, in Kisumu to be specific, a strain that caused India to record over 3,000 deaths daily. You would think people are more aware of what is COVID-19, its effect to the body system, and that isn't the case in the street of Nairobi. These are the sentiments of some of Kenyans.
Kulingana na sisi, hatujakuwa na imani na corona kwa sababu yale yanatendwa na serikali imefanya sisi hatuna imani kwamba kuna corona. Kwanza ukiingia kwenye magari, hakuna mtu ana spray magari, tunaingia mwingine anashika gari, hiyo ni corona tayari.
People don't believe this thing is real. Kenda mtani watu wametangamana, sikia tu corona, it's dangerous, it can kill. But hakuna mtu wa kutuelimisha kuhusu corona zaidi.
These are just but a few sentiments from Kenyans reflecting the lack of awareness on COVID-19. In our journey, we bring you the exact facts. COVID-19 has a lot of myths and misconceptions surrounding it. We are here at Nairobi Hospital to demystify these statements. Thank you so much for your time. Does COVID-19 have a cure?
Cure in that sense, like it can be killed, no. But being managed, yes. But particular cure, we still don't have one antiviral that kills the virus. But yes, we can slow progression and contain the disease when caught early. COVID is real. We have seen people die. So as Kenyans, we have to remind ourselves that this is not a myth. This is not a propaganda or something that has been put forth to try and injure us psychologically. It's a real occurrence and it's confirmed by science and it exists. So we all have to ensure that we still wash our hands, observe respiratory etiquette. When you're sneezing, when you're coughing, you make sure you're covering up, wear your mask. You make sure that social distancing, we have to change our culture on how we interact as human beings. We know human beings are social beings, but social distancing, we have no choice.
Can one get COVID-19 from rails and peppers?
Even when you're in public places, you don't know the next person, whether they're the ones who are carrying the virus. So from rails touching surfaces in public and people touching the surfaces, not wearing your mask, those then poses a risk because then you can contract the virus because even maybe your best friend has it and they have no symptoms.
There's so many myths about COVID-19. We are still with Ayub. And just, you've seen the comments are being made by some youths. Do you feel the youths have been left out in the fight against COVID-19?
Well, I think if you look at it actually depends on what aspect of the fight against COVID-19 that we're talking about. Because today when you look at COVID-19 itself, it's one thing to talk about the disease and its impact on its effect on a person, but also the greater effect that it has brought to the community. So if you look at the fight against COVID-19 from the technical medical perspective, I would say the medical experts have done their jobs and the government and Ministry of Health have done their job in whatever they have been able to do so far. But then when you talk about the general impact of COVID-19 and the fight to mitigate its effects to the communities and young people, I would say that we might have not really handled it the best way possible as a country itself, because probably one of the reasons it's been new to all of us. You know, young people have been to spaces where they just don't know what is next tomorrow, and that is a very dangerous situation for any country with this number of young people, over 70% of this population being there.
Speaking about resilience that has come out of the support by Kenya Red Cross Society, what are some of the successes that you can tell us about that you've been able to achieve during this period?
Yeah, I'll be honest with you. One of the things that we never imagined was a situation where young people will be the frontline people to fighting COVID-19. That was something that was quite new to us.
Yes.
We saw young people take up community outreach programs, awareness creation, relief distribution. We also saw young people lead the fight in terms of just being able to be the agents of change, because there was a lot of behavior change that needed to happen in order to combat the infection and prevention and control measures for COVID-19. And young people basically came in to do this. The other interesting thing is that we saw young people being innovative. And we have a good case where our youth chairperson from Kajiado, Bwana Daniel Kabugi, is actually among the team of students that was from Kenyatta University that actually created those ventilators that we saw on TV. So this was a number of other initiatives that we probably might not be able to talk about today, but a lot of young people came in to just say, I can do this, and this is the little that I can do. I just need extra support to get from one point to the other. And this is an amazing time that we can always say the young people are the right people to invest in whenever we have any pandemic.
Thank you so very much. And with those particular comments, we come to the end of that particular segment. Thank you so very much for having time for us. That was none other than Alex Ayub, the National Youth Coordinator for Kenya Red Cross Society.